If you are currently or considering taking hormone replacement therapy, natural hormones, maybe synthetic hormones, or bioidentical hormones, today I want to share with you the most powerful and impactful form or format to deliver hormones into your body so that you can create the most optimized hormone balance that you are seeking with this type of therapy. When it comes to hormone therapy, there are an assortment of formats or delivery methods that you can choose from. And today I want to list out those formats and then also share with you the best way to deliver any of those hormone therapies that you're seeking, how to maximize their results, meaning delivering hormones in the best therapeutic way possible. So to break it down, there are 4 different ways for you to get hormones into your body. The first and most common way is going to be in a pill form. Most of you might be familiar with the birth control pill. Those tend to be digestible. We also see other hormones like progesterone being often prescribed in a pill format. I'm going to tell you that's not the best and most optimized delivery method, even though we see more of the digestible hormones on the market than any other options. Now, the second option that is very common and has really risen in popularity are the intramuscular and transdermal pellet therapy, where you go to a clinician's office and they either have an injectable pellet that they put either in your arm or usually around your hip butt area, or there might be a needle that's being used for an intramuscular delivery of, say, an androgen like testosterone. One of the challenges is pellet therapy is definitely trendy and it's a little bit of a wild west in terms of the quality control. That's where I've actually seen women in their early and mid 50s roid raging and feeling like they're 19-year-old teen boys, that their hormones are really intensely being released and their body's not able to manage that. It's not a healthy release method. It felt like there was a lot of chaos of roid raging patients in my clinic. In 2016, 2017, there were some major changes in the manufacturing world, but we still see a lot of women experiencing the negative effects of the pellets. And because it is not as standardized and because it is a little bit of a wild west still therapeutically, I definitely recommend staying away from that methodology. The third option is to use a transdermal delivery method. Most notably are creams like these. Usually the delivery method is a pump or a 1/4 teaspoon to be applied at a certain area and rotating those areas. Another transdermal delivery method are patches. They're usually round and they might be a combination of estrogen, progesterone, and testosterone to be worn for a certain period of time, usually 4, 5, 7 days at a time, and then be removed and reapplied throughout the month. Now the idea here is that there's this consistent delivery method with the patches of this releasing of hormone into your body. That's not always the case. That's one of the reasons I'm not a huge fan of patches. I do recommend frequently creams for my patients. And last and final is one you probably didn't know was an option, but I'm a huge fan of and find that it has the most effectiveness in terms of leveling and balancing hormones, as well as reducing a lot of the symptoms that my patients complain about. And it is using hormonal suppositories. So this is an example of a suppository that is transvaginal. So it is inserted vaginally every evening before you go to bed. And one of the things that's really unique about suppositories in general, especially vaginal suppositories, our mucosal membrane, our vaginal mucosa, is very receptive to hormones. And in fact, it is very influenced by hormones. That's one of the big complaints that we see with women at the end stages of perimenopause and menopause, is that the hormonal changes actually affects their vaginal mucosa, that there's a thinning of the mucosal lining and an atrophy, if you will, of the vaginal canal. I find using the suppositories and creams collectively together, so this is a combination, these are the most effective delivery methods. So transdermally, that method, we're able to deliver more potent, powerful hormonal therapy. And then from a suppository, a transvaginal delivery, that is extremely potent. And the proof is in the pudding. I've worked now for over 15 years monitoring and evaluating patients' labs, blood draws and saliva samples, and even blood spot testing where we analyze hormone levels. What I've found is that we get a stronger, more effective, and more balancing management of hormone therapy via a combination of suppositories first, and then a transdermal cream. I also find this to be less overwhelming to the system. Unlike a pellet, you're not getting a quick hit of, say, testosterone. And even testosterone is one of those things. I recommend testosterone creams. That's my favorite delivery method, and the one where you're going to avoid roid raging, which does happen. And comment down below if that has been your situation. So reach first for suppositories and use creams as an adjunct, and that combination is a powerful way to ensure that your body is absorbing, assimilating, and balancing hormones in your life. If you're struggling with your hormones and having a tough time maybe balancing them on your own, or maybe you feel like you're striking out with an assortment of medical providers, I'm going to recommend 2 of my master classes. I've created these master classes to really address a lot of the common problems I see and hear with patients. And ultimately, the core piece when it comes to hormone therapy is not just using these creams and the suppositories. These, in some cases, are Band-Aids. We need to address the real root of why your hormones are imbalanced. And there are deeper, more metabolic, influential hormones that are in control of your hormone, your reproductive hormone levels. So it's really important that you address the root cause and address some of the healing that's required in your body to stabilize and balance your hormones. So I'll post those in the description box below. My hormone mastery class and my surviving menopause cover all the ranges from early teen hormonal imbalances all the way through perimenopause and postmenopausal. So I hope you consider enrolling in those classes. As always, it's my pleasure to be a resource for you. I hope you hit that like button, hit the follow if you haven't subscribed, and I look forward to seeing you on my next video. See you later.